Hello, Dr. Karthik Gunasekaran from the Metromale Clinic. We're situated in Chennai, Nagar, Thoraipakkam and Puram. I was talking to you about genital warts in my last video, and following up on that, I thought I would complete the two-part video by talking about the complications of genital warts and also about the treatment part of genital warts or condylomas as they are called. Now, I already told you that condylomas are caused by two particular strains of human papillomavirus type 6 and 11. Most of the time these condylomas are asymptomatic, meaning they do not present with any problems. They're quite silent. They're very, very small usually, and sometimes they're just on the thighs and in the anocutaneous region where they don't really bother you, but sometimes they can present with huge, large cauliflower-like masses that can be on the undersurface of the foreskin near the glands, and these things can actually obstruct the flow of urine. How do they obstruct? Because they can grow into the urethral opening. The urethral opening is the opening through which urine comes out, and so when it gets in, it obstructs the flow of urine. And sometimes because of the size and because it starts ulcerating, once they become too big, then they can start bleeding. So as long as these things are very small and very subtle and asymptomatic, you don't have to really treat them, because as long as you're not having sex with anybody, you can be safe. It's not going to spread to your partner. Now, but if they do cause complications, then definitely you do have to visit a doctor and then take treatment. Now, how do you treat them? The smaller ones can be treated with solutions that can actually corrode the wart and remove them. Now, albeit you have to be very, very careful with these solutions, because these can actually corrode the skin around the wart, and they might create a much bigger problem because they might cause ulceration and fungation of the area of skin near the wart. So when you do apply acid, you have to make sure that this acid does not corrode the surrounding area. Now, if it is too large an area, then you cannot apply these water removing solutions, because if you do apply these water removing solutions, then the whole area becomes fungated and ulcerated, right? So that time you would need a surgical removal. Now, surgical removal can be done by three ways. Either you can use an electric current, whereby simple diathermy you can use and remove these warts if they are small enough. You can do cryosurgery. So basically cryosurgery is where you use liquid nitrogen and kind of freeze the skin around the wart so that it kind of withers away and falls off. Or finally, the best solution would be the use of a laser. In our setup, we use the Holmium-Yag laser. Now, the Holmium-Yag laser is very, very precise. It's got a very, very thin, minute beam which can ideally cut the wart at the base where it kind of joins with the skin, leaving no residual scar. So that's probably the best way to treat the wart, and patients are having wonderful results with this laser treatment. So like I said, as long as the warts don't cause any problems, you don't have to treat them. But the minute the warts cause problems, you have to treat them. And it's always better to cover these patients with antiviral therapy. But most importantly, these patients have a lot of emotional distress, because the HPV infection never really goes away, right? So they have a lot of emotional distress, and proper counseling from a sexologist is very, very important. Now, the advent of the HPV vaccines, this is definitely a new tool in our armamentarium. So you can go ahead and use it as long as you've not become sexually active. Both for young men and women, the HPV vaccine, there have been massive trials, and people are showing good results. So thank you for watching, and please subscribe to us.